this session, you're going to learn and know more about OHDSI India. So OHDSI is a global open source community that focuses on enabling large-scale analytics of healthcare data. So their main goal is to promote better healthcare decision making by using real-world data to perform meaningful analysis. They do this by helping standardize healthcare data from various sources and making it easier to perform research. Now, OHDSI India chapter specifically is dedicated to building a robust community focused on generating real world data and evidence in India. So, by bringing together experts from academia, industry, and healthcare, the chapter drives innovative research and contributes to healthcare analytics. Mr. Parthiban, as the president of OHDSI India, has been a pivotal leader in advancing these efforts. His work in fostering collaborations across data partners has been instrumental in building a strong Indian community that can influence healthcare outcomes and decisions. So, with this, I'll hand it over to Mr. Parthiban to tell us more about OHDSI India, its visions and goals in the healthcare research space, and talk a little bit about the work that they're doing. So, Mr. Parthiban, over to you.
Thank you so much for the introduction. Can you bring up the slides? Yeah.
Yes.
Okay. Thank you, everyone, for joining this call wherever you are. So I'm representing OHDSI India chapter. So let me quickly go through the agenda. Okay. Let me go to the. I will be introducing OHDSI and what is OMUP CDM and one bit of case study and our initiatives and future plans. Maybe I will try to cover everything in 15 minutes or so. So OHDSI is Observational Health Data Sciences and Informatics. So as it has been introduced, this is a volunteer community from all over the globe. And this brings multiple stakeholders, government, academia, health system, hospitals, and various entities. And why this has been done is we have to have a large-scale evidence, generating large-scale evidence from the huge set of data that is available in so many data sources currently not accessed. And this would help to make a better healthcare decision making. The chapters or the members are spread over 100 plus countries, and this network has got something like 600 million patients. And the main thing that we do is the volunteer community has developed open science tools to normalize the data from various healthcare sources, and then we can do a large scale analytics. All the open source tools are available from the community, and this is a very supportive community, and this can help in data standardization, that quality improvement, effectiveness, comparison, risk prediction, data characterization, safety surveillance, and so on. So OHDSI India chapter, as you see on the right, there are chapters available in various regions, and we wanted to create an India chapter that can address the Indian data challenges and also cover more research on the Indian patients. Of course, we have the largest disease burden in the world, and we don't have enough data sets to cover that kind of research. So Global Value Web, along with Johnson & Johnson Pharma and JSS College of Mysore, we have joined hands, and we are the founder members of this India chapter, and we are actively adding more partners as we speak. And the benefits, as I told, like 600 million patients, 5 billion records are part of this system. We can't access the records. It is all owned by the data partners. But if you have a use case, you can reach out to the partners, and they will give, you can run your algorithms on the data. You can never access the data, but you can run your algorithms and access and get the results out of that. and currently more than 2,500 researchers part of the thing. And there is, as I told, it's a very supportive community, and it has got a host of software applications that you can really use for healthcare data processing. If you have to do research, means you need to bring all the data from varying data sources and formats to a common data format. So the common data format adapted as OMOP. So OMOP CDM, that the way we call it as CDM, common data model. OMOP, you see the below expansion for that. So the idea here is you, from various sources, you are bringing into a common data format. Once you are able to bring it to a common data format across different data from different regions, then you can do a large scale analysis, and then you can get results using the tools that are part of the RDC community. A little bit of how the whole thing works. So data collection, on the left side, what you're seeing here is you have the demographic data, laboratory data, pathologies, imaging, or your EHR data. All the data is first de-identified, and it is used. We use a host of applications to start the data extraction, standardization, transformation, loading, and we finally get that OMOP data, OMOP data archive, on which you can do your data analysis for characterization studies, incident rate analysis, um, patient population level estimation, and predictions also can be done. So this can be used for disease history, treatment utilization, clinical decision support, safety surveillance, and so on. So this is the primarily how the whole Odyssey tools and the Odyssey ecosystem works. And this just some couple of examples, like what you see on the left is pathway analysis. So you have a first line of medicines, first line of treatment and second line of treatment. What are the different medicines that was given for a particular disease, and you can have a nice sunburst diagrams will come out of the Odyssey tool. So that will giving enough idea of what is the first line of treatment medicine that is working well across the population. And also this is again for if patients, what is their chances of getting that ischemic stroke. So this is a prediction model that was done with 3 million data records, patient data records, using the Odyssey tools. And these case studies are currently available in Odyssey websites as well. So anyone interested can go through those research as well. So one of the major thing that would be addressed is, okay, when we are accessing the patient data, what are the data privacy and the security that is going to be ensured, right? So these are all important questions that will always people have. So the personal identifiers are removed earlier in the processing, and we have the data remains within the federated network, and only the results are shared across the community. So we can never access a particular patient record, even though you must have processed or gotten results out of that patient profile. So data is encrypted during transmission, so you get the maximum security is there, and access is strictly controlled based on the user roles, and you also have the HIPAA and GDPR compliance as well. And I think again multi-factor authentication is used. So I think these are all the various security features or the data protection features that are built in Odyssey to ensure that you have the complete data privacy guaranteed. And quickly going through the the use cases, clinical research, drug development, clinical trial recruitment, um, and health registries and so on. So I think for lack of time, I'm going to rush through the rest of the slides. So currently what we are doing is an Odyssey chapter. We are um, identifying a lot of data partners. We are talking to the multiple hospitals, and then we are getting them part of our Odyssey community, and then we are actually building some of the use cases or the patient research that needs to be done. We are actually working on those cases as well. And we are also working with multiple data partners for securing some funding to work on various research initiatives. And one thing what we realized is India, we have a lot of data, but most of the data are in not in a ready to use format. So we have to do a lot of data crunching before we can take it. So we need to spend a lot of efforts to get that done. And we are also setting up real world data registries. And currently one of the major study that we are doing is the breast cancer with one major hospital. And future plans, we are going to expand our community, adding more institutions, more healthcare professionals from India. And we are offering free workshops and webinars to bring their proficiency level with Odyssey tools. And we are also, once we have more data partners and more researchers on board, definitely more collaborative researches would be happening on healthcare challenges, and that would also facilitate a way to publish those researches in reputed journals. And we also going to be planning to expand on functional domains like clinical trial, drug approval submissions, and also the pharmacovigilance and safety areas as well. And we also plan to have this, we are working with the government bodies as well, sharing our experience and working with the different hospital, our research initiatives, and then we are trying to shape the policy that could help to pave a better healthcare decisions as well. So current collaborators, as you see that Janssen, GWJSS, Healthcare, of course, and a couple of universities, Health Parliament, and L&T and Lancashire Hospital as well. And we are also working with a couple of other hospitals that is not mentioned here. Arvind Eye Hospital, for example, is also one of the partners for us currently. And good news is we are having our first symposium that is happening next month, October 5th, in Geo Convention Center. If anyone is interested, please do join us, and we would be able to give us more information on how the real world Odyssey is going to help in shaping up, or at least influencing of the better healthcare decision making for India. Yeah. And you can follow us on these channels, LinkedIn, GitHub, web. So we would be happy to help you if you are interested to join us. So I think these are the things that quickly I wanted to share. And I don't know whether if there are any time to take questions or not.
We can take one question. So let me. Uh, so I think there was one question which said, "Do you manage to fetch data from government hospitals?"
Okay, what adaptations? Okay. Do you manage to fetch the data from government hospital? We have not started working with the government hospital, but I think most of the hospitals that we work with, mostly discharge summaries have the clinical data that is contained. So we have to do a lot of data wrangling to get the data out of that EHS. But good news is we have developed a lot of annotations, automated solutions that we have developed. So we are happy to try our solutions with any of the um, data partners that are coming along, or data sets that you want to give it to us. We can help you to work on that.
Okay.
I hope that answers that questions. Of course, the time is not enough. We can go into a lot of details, but I think we can take it in some other forum in some other way. Yeah,
Yes, absolutely. Thank you, Mr. Parthiban, for taking time out and joining us at the summit and for your session.
yeah.
Looking forward to long collaboration with Odyssey India.
Okay. Thank you everyone for
So
joining and listening, and a lot of questions, and we hope we would be able to answer those questions. I think Shrashta, if we can pass on those questions, we would be
I can
able
do
to.
that.
Yeah.
I can do that. I can pass on the questions and then we can share the answers.
Okay. Thank you.
Thank you.
Bye.